Good afternoon, everyone, and welcome to our November Wellbeing webinar, Diving into Diabetes, brought to you by Excellus BlueCross BlueShield. I want to start out by thanking each of you for taking the time out of your day to join us here today for our monthly webinar, part of the Excel Your Well webinar series that we launched this year. For those of you who may not be aware, November is actually Diabetes Awareness Month. So with diabetes, it is one of the most common chronic conditions in the world, yet it remains one of the most understood. So we thought it was the perfect opportunity to leverage one of our own health plan experts to discuss this topic, as it is a condition that of course can impact so many. Now, if you are new to our Wellbeing webinar series, my name is Katie Keller-Burgess, and I am part of the Wellbeing team here at the Health Plan. So I will be the host for today's webinar, teeing up our guest speaker, Amanda Sheehan. And today, Amanda will be breaking down some myths around diabetes, explaining what it is, and really providing some practical insights into prevention as well as management. So without further ado, let's dive into this topic of diabetes. Now, I do want to start us off with a few housekeeping items here today. Please note that today's webinar and all of our 2025 Wellbeing webinars are being recorded and housed on our Excellus YouTube page. So my colleague Kate is actually going to put into the chat the link to our on-demand YouTube page to access any of our previous webinar recordings, or if interested in accessing this one again, typically uploaded within a week or two following the live webinar. Another housekeeping item that I did want to call out is that all participants' microphones and cameras are automatically disabled. Now, there will be time for questions at the end of the webinar with Amanda. So we encourage you, if you do have any questions at any point, to enter them into either the Q&A or the chat. I recognize that some people don't have access to the Q&A. So really the Q&A or the chat, whichever you have access to if you do have a question. And once again, we will get to questions at the end. And lastly, it is important to note that the content covered here today is meant to be educational in purpose. But of course, if you do have any specific health-related question and or concern, we of course recommend that you connect with your primary care provider, or if you have any benefit-specific related question or concern, we recommend calling the customer care number that's on the back of your health insurance card. So I have the distinct pleasure of introducing today's guest speaker, once again, Amanda Sheehan. Amanda is a registered dietitian as well as a certified diabetes care and education specialist who has been with the health plan since February of 2023. Now, prior to coming to the health plan, Amanda worked as a case manager where she was mentored by local endocrinologists and became certified in integrative as well as functional nutrition. Now, she has a background in clinical nutrition through a local hospital where she learned compassion of diet liberalization through late stages of life in long-term care, as well as wound care nutrition. And she started in private practice both as an in-home dietitian with a diabetes focus. Her personal interests include spending time with her family, cooking, running, camping, as well as participating in dog sports with her golden retrievers. So Amanda, we are so excited and honored to have you with us here today. With that being said, I will turn the stage over to you.
Thank you, Katie. Thank you for the warm welcome. I'm excited to be here today. So let's jump into what we're going to talk about. We're going to talk about diabetes and what it is and how it affects the body. We'll talk about the types of diabetes, the common and the not so common types, the risk factors and how to know if you're at risk, complications associated with diabetes, and managing diabetes through things that we can control like nutrition, exercise, and also medication. And then I'm going to turn it back over to Katie later on to talk about more additional benefits and resources offered by Excellus BlueCross BlueShield. So what is diabetes? Diabetes is a condition in which the body's blood sugar or blood glucose is too high. So your body breaks down most of the food you eat into sugar or glucose and releases it into your bloodstream. When your blood sugar goes up, it signals your pancreas to release the insulin from the pancreas, And insulin acts like a key to let the blood sugar into your body's cells and organs to use for energy. But with diabetes, your body either doesn't make enough insulin to match what you're eating, or it can't use the insulin you are making as well as it should. And we'll talk more about that in a bit. When there isn't enough insulin or cells stop responding to the insulin in your body, too much blood sugar stays in your bloodstream, causing the elevated blood glucoses. Some common symptoms with this can be increased urination, hunger, and thirst. And you might experience fatigue, blurry vision, tingling, or pain in hands and feet as well. So the first type of diabetes is type 1 diabetes. This is an autoimmune disease, meaning that your body's own immune system attacked the beta cells in your pancreas. Beta cells are the cells that make insulin. So your immune system destroys these beta cells, causing your pancreas to no longer be able to make insulin. So treatment does include insulin injection therapy. Oral medications cannot be used in this type of diabetes. Type 2 diabetes occurs when your body does not use insulin properly or becomes insulin resistant. So your pancreas is making insulin, often making extra insulin to make up for what you're eating, but eventually your pancreas cannot keep up with regulating your glucose, causing the blood sugars to rise. In this type of diabetes, you can treat it with both oral injectable anti-diabetic medications and insulin therapy. So you have a couple more options with treatment as far as medications are concerned with this type of diabetes. And because nothing's ever black and white, there's a couple that fall in between. So latent autoimmune disease, diabetes in adults, or we call it LADA for short, is an autoimmune response like type 1. However, it happens a lot slower. So instead of like in type 1, where your beta cells are destroyed pretty rapidly, this happens a lot slower and a slower onset. Those with LADA often, well, they do need insulin therapy, but it can be delayed a little bit more so depending on how long it takes for the beta cells to be destroyed. With maturity onset diabetes of the young, or MODY, this is an inherited form of diabetes, most likely to affect young adults, but can occur at any age. This is determined by genetic testing, and it can be treated similarly to type 2 diabetes. So you can use both oral, injectable, anti-diabetic medications along with insulin therapy with this type. Gestational diabetes occurs with pregnancy. It affects up to 9% of pregnancies in the US. Placental hormones can sometimes block mother's insulin, causing insulin resistance. This can cause the body to produce more or potentially just not enough insulin, causing the blood sugars to rise. Half of women with gestational diabetes do go on to develop type 2 diabetes later in life. Women are usually screened in pregnancy between 24 and 28 weeks with a glucose tolerance test. And for most women, gestational diabetes is resolved after delivery, but again, higher risk later on in life. So diabetes is extremely prevalent in the US. 38 million people have diabetes. That's 1 in 10 people. And the surprising part is that 1 in 5 people don't even know they have it. With prediabetes, it's even more prevalent. 98 million American adults, which is more than 1 in 3, have prediabetes. And this number is a lot higher. More than 8 in 10 adults with prediabetes also don't know that they have it. So this is very important to make sure we know what our numbers are, we know where we fall. And it's also a good plug-in as well that if you are in the prediabetes category, the Diabetes Prevention Program has been shown to reduce development of prediabetes into diabetes by 58%, so very significant. So how do I know if I'm a diabetic or where I fall? Your A1C is your average blood sugars over the last 2 to 3 months in your blood work. So this is the main thing that your doctor looks at when diagnosing diabetes or prediabetes, and also seeing if you have control over your diabetes. So diabetes is diagnosed at an A1C of 6.5% or above. Prediabetes is 5.7 to 6.4, and a normal A1C is below 5.7%. Now, doctors will also take fasting blood sugar tests, glucose tolerance tests, like we mentioned in the gestational diabetes, and random blood sugar test. If your numbers are above this, a lot of times your doctor will cross-check it with an A1C as well, just to make sure that your blood sugars are averaging that amount and it's not just a one-time thing, but it's enough to flag the doctor to know that they need to look further. So it's important to make sure you get all of the lab tests that your doctor is recommending. There are some risk factors with diabetes. Some we can control and some we can't. So family history is something we can't control. If we have a strong history of diabetes in our family, we're at a higher risk, myself included with this. Prediabetes or gestational diabetes, again, higher risk. Polycystic ovarian syndrome, someone with this diagnosis has a higher risk as well. Physical inactivity, overweight or obese status, non-alcoholic fatty liver disease, and certain ethnicities also are higher risk with diabetes. So it's important to know our numbers. We want to know our ABCs. A stands for A1C. So we want to keep our A1C under 7% if we are a diabetic. That is controlled diabetes according to the American Diabetes Association. We want to keep our blood pressure in check, aim for under 140/90. We want to make sure that our cholesterol and triglyceride levels are under control. So total cholesterol, we want under 200. LDL cholesterol, we want less than 100. HDL cholesterol is our good cholesterol, so we want that one higher, H for higher. We want it greater or equal to 40. And triglycerides, we want less than 150. There are some complications associated with diabetes. And before I run through what these are, I always like to make sure I make the disclaimer that complications from diabetes can happen if we have uncontrolled diabetes for longer periods of time. So if we control our blood sugars, get them under that 7% the American Diabetes Association recommends, keep them there as long as we can, it significantly reduces the chances of development of diabetes complications. So as we do know, diabetes does have some things associated, but we can control about how often or the quickness of these complications happening with controlling our blood sugar levels. Retinopathy, so it affects our eyes and retinas. Kidney disease and failure can occur. Neuropathy affecting our nerve endings. Heart attacks, heart disease, and stroke. Diabetics are actually 2 to 4 times more likely to have a heart attack or stroke. So very important with managing glucoses and heart health. With foot complications, you can experience poor circulation or loss of feeling. And delayed wound healing can occur with increased risk of infection. Bacteria likes sugar. So we do want to make sure, again, to keep those blood sugars down to reduce our risk for wound infections. Periodontal disease or gum disease can occur. So it's important that your doctor knows and your dentist knows that you have diabetes. Hearing loss can occur. Diabetic ketoacidosis in extreme cases, and increased risk of Alzheimer's disease. Smoking also increases the chances of diabetes complications and speeds up this process. So who keeps us in check? The primary care physician is extremely important and your gatekeeper with your health. So checking in with them once a year. Endocrinologists are diabetes specialist doctors. They are the ones that manage specifically diabetes. Ophthalmologists or optometrists are important to visit, specifically looking into diabetic retinal eye exams each year. It is a special exam that they do for diabetics. Podiatrists to make sure that they check your feet for feeling. They have certain tests that they do to make sure that you're not losing any feeling or sensitivities. Your dentist, again, because of that gum disease. Registered dietitians can help with lifestyle choices. certified diabetes educators and certified diabetes care and education specialists. They also help with lifestyle and education surrounding medications. And neurologists or nephrologists if you're experiencing any kidney or nerve issues. So what can we do? What do we have control over? We have control over getting active. We have control over our nutrition. And we can go for a routine tests and screenings with your doctor. We can take the medications as prescribed by our doctor. And if it's applicable, we can quit smoking. So let's get moving. Exercise is so important with managing diabetes. It actually can reduce blood sugars up to 48 hours after exercise. So it is huge with managing your glucoses. Overall, we want to aim for at least 30 minutes a day, 5 days a week, which is 150 minutes of moderate intensity aerobic activity, or 75 minutes per week of vigorous intensity aerobic activity. And we want to add muscle strengthening at least 2 days a week to help with that uptake of glucose. If we have more muscle mass, it uses more glucose in the body. So we want to maintain our muscles as we age, and muscle strengthening is important with that as well. And it's kind of surprising because only 1 in 5 adults and teens get enough exercise to maintain good health, according to the American Heart Association. I do want to mention too, if you are new or starting a new routine, you always want to make sure you consult with your doctor before starting a new exercise program. Diet and diabetes is the other half of the coin with lifestyle, right? So there are a couple things that we can control with that. If it is indicated to promote weight loss, we do want to do so. Try reducing calories by 500 to 1,000 calories a day, depending on your nutrition needs. We do want to reduce our unhealthy fat intake, which we'll talk about in a little bit. We want to limit added sugars in our foods for both foods and beverages. We want to increase the fiber in our food. So women should try to aim for about 25 grams of fiber a day and men 38 grams a day. And we want to make half of our grains whole grains. We want to up our fruits and vegetables, specifically our non-starchy vegetables, which I will go through in a bit here. And we want to follow the American Diabetes Association plate, which they have a really nice diagram for us to help portion our plate, which I will give you a picture of too. So it's important to make sure we eat a balanced diet of all 3 of our macronutrients. Our macronutrients are carbohydrates, proteins, and healthy fats. So carbs are the main food group that our body needs for energy. It's our brain's main energy source. But with diabetes, we have a broken chain in our metabolism, not letting us digest the carbohydrates appropriately. So it's important to make sure that we spread our carbs out throughout the day and not have them in one sitting. Carbohydrates take about 2 hours in our body to digest. So again, more important to watch how many carbs we're having at a sitting rather than per day. And we do need to have them throughout the day because it is our brain's main energy source. So what are carbs? And again, before I go through these, I want to stress, I'm not telling you you can't eat these foods. I want you to eat these foods. It's just that we want to make sure that when we sit down to have a meal, we're only picking maybe 1 or 2 things instead of everything from this category. We're also picking proteins and fats at our sittings or our meals. So carbs are things like grains, cereals, rices, and pastas. They are fruit and fruit juices. They are milk and dairy products, except for cheese. That falls in the protein category. They are obvious sweet things like sweets, candies, cookies, baked goods, soda, and sweetened beverages. And they are starchy vegetables like peas, corn, potatoes, beans, legumes, and winter squash like butternut or acorn squash. Non-starchy vegetables fall in the carbohydrate category, but they are the least dense, meaning they have the least amount of carbohydrates in them. So their portion size is a lot larger than the other items on the first slide. So I want you to eat more of these. So if you like any of these vegetables on this grid, take note. We want to have up to 3 cups worth in a sitting, if it's raw, or 1.5 cups cooked. So again, as many of these as you like, as far as fat filling up on them, these are the ones we want to eat more of. With proteins, we want to try and pick lean proteins. Remember, we said diabetics are at a higher risk for heart concerns. So again, lean proteins, we want to take account of heart health eating as well. So chicken breast, turkey breast, pork loin, 95% lean, ground meat, veal loin, egg whites, nuts, and seeds. Fish, specifically our fattier fish like salmon, sardines, tuna, herring, oysters, clam, crab, shrimp, and lobster. And then we want to limit the higher fat, unhealthy fat proteins, which would be things like bacon, beef, hot dogs, pork spare ribs, bologna, salami, pastrami, bratwurst, Italian sausage, and Polish sausage. With fats, we want to make sure that we have healthy fats. Healthy fats are our unsaturated fats more often at our meals. So nuts, seeds, avocados, olive oils, vegetable oils, and the fattier fish that I had mentioned in the slide before. Some unhealthy fats or saturated fats are the ones that we want to be careful of in making sure that we have a smaller amount of these types of things. So high fat meats, dairy products, butter, heavy cream, cheese, lard, coconut oil, and palm oils. And just to give you a value, we want it to be less than 6% of your daily calories. So for someone on a 2,000 calorie diet, that looks like 11 to 13 grams for the day on saturated fats. We also want to make sure that we're picking lower fat or healthier cooking methods. So baking, broiling, grilling, roasting, and low heat saute. It's important to make sure that we keep our sauteing on a lower heat and not heating the pan to the point of frying. That is important with maintaining good health. Trans fat is a tricky one and often gets a lot of people. So with trans fat, we want to make sure that we're reading the ingredients on our foods to see if it has partially hydrogenated oils in the ingredients. And the reason we want to do that is because if a product is less than a half a gram of trans fat, the label can still be listed as 0. So it's important to make sure there's not any hidden trans fats by looking at the label to see if there's any partially hydrogenated oils in the product. This can be found in baked goods like pizza dough, pie crust, cookies, crackers, and actually peanut butter as well can use this to keep it from separating. So just read your labels and be mindful if there's this ingredient in there. The diabetes dinner plate is a nice diagram helping us kind of portion our plate at dinner time to be more diabetic friendly. So what you'll notice is our number 1 category, which is half of our plate, are those non-starchy vegetables, that nice big grid of veggies we said we want to eat a lot of. So those are where we put the 3 cups worth of raw veggies or a cup and a half cooked. The second category is our lean proteins. So our chicken breast, turkey breast, pork loin, fish we talked about. And then the last category, the last quarter of our plate is our carbohydrate category. So you can still eat them. It's just that we want this portion a little bit smaller. So only like a half a cup to a cup of a starchy vegetable, a third to 2/3 a cup of pasta or rice or grain, or 1 to 2 slices of bread. We want to make sure that we're reading our labels. So this is where we can really dive into what is in our food and how it can help manage our health. So we want to look at the serving size. We want to look at those saturated fats, those unhealthy fats we talked about. Lower the better. Remember, 11 to 13 grams for a 2,000 calorie diet. Again, unsaturated fats are the healthy fats. Sometimes they will be listed, sometimes they won't, like on this label. We want to look at our total carbohydrates. It is listed as number 5 on this picture. And the reason why I want to call that out is the total carbohydrates gives us the number in grams, that's 37 grams, of all of the foods that raise our blood sugar. Remember, we said carbohydrates are the food group that raises blood sugar. What you'll notice is underneath there is total sugars, and that at number 7. And that is indented under total carbohydrates, meaning it is already counted in the total carbohydrate line. So that 12 grams is already added into the 37 grams of total carbohydrates. So that's what we want to look at when we're looking to see what foods raise our blood glucose overall. Our fiber, we want to be 3 grams or more for breads, rice, pasta, cereals, and grains. Higher the fiber, the better. And we also want to take note about how much protein is in our foods. I wanted to give you a little bit of a guide for healthy snack ideas. So this is something that I get asked about a lot. What do I have for a snack? So we want to try and pair our protein and our carbohydrates together. Remember, we said we don't want to pick just from the carb category. We want to pair with other food groups. So ideally with protein, when we were looking at that label, we want it around 6 to 7 grams for our snack. And I gave you an idea of some listings of some ideas of what that would look like. And then we would want to pick from our carbohydrate category, ideally around 15 grams of total carbohydrates for a snack portion size. So again, you could pick anything from your protein category and then pair it with anything from the carbohydrate category listed here. Some ideas for healthy swaps and trying to reduce the amount of carb load in your meals can be using rice, pasta, or potato heavy dish swaps for rice cauliflower, zucchini noodles, spaghetti squash, or mashed cauliflower. If you don't necessarily like the mashed cauliflower or rice cauliflower by itself, some people like to mix half and half. So half regular rice, half riced cauliflower to make the dish spread a little bit further. With deli subs and sandwiches, you can use low carb wraps, lettuce wraps, or reduced carb breads. With sweetened beverages like soda, juice, and tea, we can use unsweetened seltzer water, or we can water down our juice with either regular water or seltzer water to make it like a sparkling juice or an unsweetened tea. With white flour, we can make a swap to chickpea or almond flour. And the reason I'm mentioning this and not whole wheat flour is because whole wheat flour will have similar amounts of carbs. So for example, your chickpea flour has 27 grams of carbohydrates in a half a cup and 48 grams in a half a cup of white flour. So that's significant in your carbohydrate load. With pizza, we want to try and switch to cauliflower crust pizzas if we can. And then instead of granola on the yogurt, granola and yogurt both fall in the carb category. So remember we said we want to swap out for a different category rather than just carbs. So instead of granola on the yogurt, maybe we go with almonds or walnuts or something in the nut or seed category, which is more protein based on the yogurt. And then instead of chips with dip, we want to try and pick more of those non-starchy vegetables. So like our carrots, celery, pea pods, or peppers with the dip. And instead of fruit pies or baked goods, maybe we use berries topped with whipped cream or paired with one dark chocolate square for our sweet tooth. So let's wrap this up. When we are living with diabetes, we want to make sure that we're eating healthy food, we're moving and staying active, we want to monitor our blood sugars, we want to take our medications as prescribed by our doctor, and we want to manage stress. Easier said than done, I know, right? But stress actually does increase your blood sugar levels because it increases cortisol levels in your blood. So we do want to try the best that we can, especially going in the holidays, right, to manage our stress as much as we can. It's good for our blood sugars. And then continue to build on the healthy habits you've already started making. So just continue to build on some of the things you've already been doing and slowly work your way up to some goals. If you're looking for some additional recipes with diabetes, the Diabetes Food Hub is a great resource. It's run by the American Diabetes Association, and they have a lot of diabetic-friendly recipes for all different things. The Academy of Nutrition and Dietetics is the credentialing agency for registered dietitians. They also have a lot of healthy recipes. And the Center for Disease Control, or CDC, also has recipes and a diabetes-friendly cookbook on their website as well. Some additional links and references for looking into diabetes information can be, again, the Academy of Nutrition and Dietetics, the American Diabetes Association, the American Association of Clinical Endocrinology. Remember, endocrinologists are the diabetes specialist doctors. And then the Centers for Disease Control also has some good resource information on diabetes. And I'm going to pass this off back to Katie to talk about your related benefits.
Amanda, Thank you so much. That was so great. A lot of information covered, very educational, and you can definitely tell you have some passion and expertise in this field of diabetes. So thank you for sharing all of your knowledge and passion here with us today. So we will get to questions in just a minute. So as mentioned, if you weren't here in the beginning, please enter any questions that you may have for Amanda within either the chat or Q&A, and we'll get to them in just a minute. But before doing so, I did want to dive into, as mentioned, some related benefits that may be available through Excellus BlueCross BlueShield as part of your membership. So the first benefit that I am going to review is our Find a Doctor tool. So if you were to go to the Excellus BlueCross BlueShield online website and access your member portal or go through our mobile app, there is access to a Find a Doctor tool that is providing our members with access to in-network providers that are really based on the search that you are looking for. So I say that because you are able to filter by specialty. So I know Amanda mentioned some different type of specialties such as endocrinologist. So once again, you're able to search based on maybe the specialty, maybe the different facility type, whether it's an urgent care, hospital, etc. And really, once again, find those local as well as potentially national networks. You are able to once again filter those results then by potentially languages spoken, if the provider is accepting new patients, and then able to see a side-by-side comparison of those providers to really make an informed decision on which provider in network is best for you. So we do encourage you to be logged into your online account to access the Find a Doctor tool, so it is more specific to your plan, potentially deductible, spending, etc. if you were to utilize the cost estimator tool as well. So both of these tools can be found under the Find a Doctor tab on your Excellus BlueCross BlueShield online member account. Now, as Amanda mentioned earlier, there is a member care management team here at the health plan that is inclusive of a variety of healthcare professionals, such as registered nurses, registered dietitians, respiratory therapists, and more. And this team of healthcare professionals is really here on the back end to support our members of all ages at no added charge. So with access to our care management team, it is really providing our members guidance, support, and a personalized care plan. If you are looking for that added support in any condition and or concern that you see listed here on this slide, such as behavioral health concerns around depression, anxiety, stress management, as Amanda alluded to, or maybe some chronic conditions such as diabetes management, as Amanda alluded to, or high blood pressure or high cholesterol. As we know, once again, as Amanda mentioned, that many of those conditions are impacted by some of the same lifestyle risk factors. So a lot of great work and support that can happen from our care management team. And this team is available through phone, through email, or as you can see on the right-hand slide here, and as mentioned, through the free WellFrame app. So WellFrame is an app that Excellus members can download and create your account. And through that app, you have personalized chat feature with our care management team. So once again, if interested in accessing them through that WellFrame app to have that text feature to be more convenient, flexible, and help answer any of your personal questions, they are there to do so. I do want to call out the access code when creating your WellFrame account is Excellus Welcome, all one word, all lowercase. And then the next benefit I wanted to highlight is one that does vary based on contract. So once again, availability of this benefit does vary. But ThriveWell is a digital health and well-being platform that really helps provide our members access to tools and resources to support small everyday changes to your well-being. So whether that be trying to be more physically active or trying to eat healthier or trying to better manage our stress levels. Once again, through ThriveWell, our members have a variety of tools, resources, challenges, journeys, and more to really help support those everyday small changes, as well as access to a certified health risk assessment that helps to identify areas of opportunity based on your personal experience, and once again, what you can help to engage within that platform. And then the last related benefit that I did want to cover is Blue 365. And this is an online marketplace where our members can save money by getting a variety of deals and discounts at popular health and wellness related vendors across the country. So there's a variety of categories such as fitness related deals, nutrition related deals for healthy eating, apparel and footwear, and more. So members can once again create their Blue 365 account at any time for free and then access those deals and discounts, see if any are a good fit for you, and then redeem them if it is one. A couple of the ones I do like to highlight are the gym membership passport deals available through Blue 365. It is probably one of the most common questions I get when I'm out at a wellness fair is, do I have any type of gym membership available through the health plan? Yes, there are discounted gym membership programs available through Blue 365. So once again, definitely check it out if interested in, accessing a fitness facility going into the new year. All right. Well, with that being said, once again, I want to thank everyone here for your time today. Before we do move into the questions section, just wanted to give a quick plug for our December well-being webinar. Really nice, segue going into this topic of healthy holidays, eat, drink, and be mindful. So that is going to be with Lindsay Ledoux, another registered dietitian here at the Health Plan. And she is going to be talking about how to navigate holiday gatherings with a little bit less stress, being mindful and intuitive eating strategies, simple planning tips for helping to set yourself up for success, eating while on the go, maybe for traveling this holiday season, and more. So this webinar is going to be Thursday, December 18th at noon. And if interested, the QR code here on the screen to scan and, register, or my colleague Kate in the chat, once again, will place that direct registration link if interested in registering through that method. So with that being said, let's get to any questions that we have had come through. I've seen some pop up, so I'll move over there. Amanda, what I'll do is read them off to you and then allow you a couple minutes to answer. All right, we'll go into the chat. Question, Amanda, what causes beta cells in the pancreas to die or no longer function? And have diabetes rates in the US increased or decreased in recent years? And if so, why do you think?
Great question. If we knew exactly why diabetes happened in some and not others, that would be the $1,000,000 question, right? Because then we would know how to prevent it fully. What we do know is that people that have specifically like type 1 diabetes, the autoimmune response, they have something called GAD antibodies that we notice in the blood work that your doctor can take to see if you have that and determining if it is a type 1 response or not. And again, with type 2, some people have the beta cells die off one by one, but a lot of it is insulin resistance. So your body is making insulin. It's just that your body's not utilizing it properly. So we can increase your body's uptake of insulin or uptake of glucose with some of those lifestyle factors. We talked about maybe weight loss, increasing activity, things like that. And then as far as your second part of the question with asking if it is more prevalent, it is. It is definitely more prevalent. I do think that there's some things with overall lifestyle that were more inactive. Like I had referenced one of the slides earlier that only 1 in 5 people get the recommended daily activity. And then we're also a country of convenience right now with a lot of convenience options. So again, going back to basics and picking more of our whole foods, our fruits, our vegetables, and getting active, I think is really important with managing diabetes. But again, what some cannot be for all. So some people, they have a high genetic factor like the Modi experience where, that is something that can be a player with this as well.
Great question. Thank you,
Yeah.
Amanda. Another question, really no indication or concern that there may be diabetes, but this person regularly eats healthy and exercises regularly. How frequently should they be monitoring their blood pressure, blood sugar levels to make sure everything looks okay? What would you recommend?
Yeah, connect with your doctor. The doctor usually does yearly blood work on you. And again, that fasting glucose is the first indication. So if that fasting glucose starts to creep up, that's when the doctor might recommend an A1C. But also kudos to you for, being as healthy as you can now and taking advantage of it and staying on top of things and asking these questions. That means a lot for your overall health and prevention. So that's awesome.
Absolutely. Thank you. Another question I did see come through is regarding maybe coverage for continuous glucose monitors. I do want to call out that benefit coverage does vary. So if any, questions relative to what is covered for your specific plan, we recommend calling the customer care number on the back of your health insurance card. But can appreciate that would be a helpful tool to learn how food and activities can affect your blood glucose level. So thank you for that call out there. Any other questions? It does look like a couple of questions have come through regarding if the slides can be sent to you. I am happy to do so. I am just going to put my email address in the chat. And if you would like a copy of the actual slide deck, please don't hesitate to reach out to me via email and I can send to you directly. Otherwise, as mentioned, the webinar was recorded and will be placed on our YouTube page within the next week or so. Give it a little bit of grace period with the upcoming holiday. But you can, of course, access any of the slides there through that recording.
Do you mind if
And
I
of
tack on to that too, Katie?
course,
Just to plug in, we do, like Katie mentioned, we do have registered dietitians and diabetes educators available to you through your plan. We also have individualized, snack ideas, things like that. Some of those were excerpts from the handouts we already provide to our members. So if you're interested in working with one of us to get further information, you can also call that case management line that Katie had referenced.
absolutely. Great call out, Amanda. And I think that is a common question that I hear out in the field once again is members think that they potentially have to have a diagnosis, right, to engage with our care management team and the registered dietitians through there. But really, your team can be apt to help kind of support the healthy habits before maybe that condition is diagnosed, if you will. So, yes. Kudos to you and the entire registered dietitians on your team for all the support that is able to be provided to our members. That it is personalized, right? It is that one-on-one support that can be provided to help answer your direct questions and what may be meaningful to you. Um, all right. I don't see any other questions that have come through. So I do want to give a plug, my colleague Kate in the chat as well. Kate, if you wouldn't mind plugging it in one more time. There is a brief 2-minute survey that we are asking any participant willing to take to give feedback on today's webinar, as well as provide feedback on future webinar topics that you would like to hear more about, as that really does help to guide us, in what we're bringing forward to our members. So once again, if you wouldn't mind taking 2 minutes out of your day to give us that feedback, we would truly appreciate it. But with that being said, once again, thank you all for taking the time out of your lunch hour to spend here with us today. Hopefully you're able to take away something to learn from, implement into your day. Amanda, once again, thank you for your time, passion, and expertise here today. Very much appreciated. Some great feedback already in the chat, as I'm sure you can see. But we hope everyone has a wonderful Thanksgiving holiday and hope to see you at next month's webinar as well.
Thank you all. It was my pleasure. Have a great day.
Thank you, everyone. Bye.